Bit of confusion in New York State, where St. Andrew of COVID-19 is the governor. Interviews with multiple county officials in New York State over the past week confirm many are unclear why the governor's administration has not activated the county-by-county system, a plan that included recent practice sessions in which members of the public received regular flu vaccines at drive-through sites. In Albany County, officials have privately said they could vaccinate the population of the southern half of the county in a few days if they were given the coronavirus vaccines and allowed to mobilize their plan. And yet, I haven't heard any pointed questions in the direction of St. Andrew of COVID-19, but there was a pointed question on vaccines and the distribution and the efficacy of said, directed at Governor Ron DeSantis of Florida by fungible CNN reporter. Her name is not important. And this is how that went. Ron DeSantis is, I think, a more polished version of Trump when it comes to dealing with the press. This is highly entertaining. At least it was for me. I hope it is for you.
Governor, what has gone wrong with the rollout of the vaccine that we've seen phone lines jammed, websites crashing?
There's a lot of demand. I mean, I think at the end of the day, excuse me.
If I could finish my question.
You just said what has gone wrong, so I'm answering the question.
If I could complete the question, though.
So you're going to give a speech, or are you going to ask a question?
With all due respect, Governor,
you asked the question. I'm going to answer it.
Finish my question.
You're giving a speech. You asked the question.
I am trying to ask you the.
You're going to ask how many questions? You get 3? They only got 1 question. Why do you get 3?
With all due respect, Governor, I'm just asking if I could finish my question.
You didn't. You finished the question.
I did not. My full question is what went wrong with the rollout of the vaccine when we've seen phone lines jammed, websites crashing?
So you're repeating your question.
To complete it for you, Governor, we've seen websites crash and also senior citizens waiting overnight for the vaccine.
Where was that at?
We've seen it in Duval, Broward, Orange, and Lee County.
And why in Lee, why did that happen? Did you investigate why?
That's my question to you, Governor. You're the governor of the state. I'm not the governor of the state.
Okay, but you didn't investigate why that, like in Lee County, why was there a big line? Did you investigate why?
Could you tell us why?
Because we distributed vaccine to hospitals, and the hospital said, first come, first serve. If you show up, we'll do it. So they didn't use a registration system. There wasn't anything that was done, and there's a lot of demand for it. So people are going to want to go ahead and get it. So
there was no plan then from the state to make sure that senior citizens didn't wait outside overnight?
So the state is not dictating to hospitals we're not dictating to Carlos Magoya how he runs his operations here. That would be a total disaster. These guys are much more competent to be able to deliver healthcare services than a state government could ever be.
Wow. Drop mic, go home.
Well, it's just a great tutorial about, it's really a discussion of subsidiarity, but of course that's a bit esoteric for general consumption. The idea that, hey, look, it's the DeSantis disposition, and it's then the disposition of a number of other governors, Christine Ohm in South Dakota, Brian Kemp, really generally in Georgia, which is say, like, we place our trust in our constituents to be sensible. We're trying to get people the resources they need, whether they're the medical professionals or their staff at nursing homes and long-term care facilities, or they're the residents of those facilities themselves. We're following a progression, but we need partners here. This idea, the state has a plan and then a wand is waved and everything just is implemented without wrinkle or incident, is the sort of magical thinking that exists in the D.C. press corps. Ron DeSantis exists in the real world, where he needs partners, including in the private sector, to get the job done.
Right. U.S. Surgeon General Jerome Adams yesterday said, hey, governors, ask CVS, ask Walgreens to help you roll out this plan. The vaccines are there. Let's do it.
For more on this topic, we're pleased now to be joined by Eric Hargan. He is the Deputy Secretary of the Department of Health and Human Services. Eric, thanks for joining us. Appreciate it.
Good to be here.
So last month, but just before Christmas, when Secretary Azar was on the Sunday Talkies talking about the vaccine distribution and going back and forth with the likes of Margaret Brennan on the topic, he sort of suggested the system that had been set up and the metrics they think that could be met, with the caveat there that, because of these are state and local matters, we're drilling down to states and localities and their partners at the local level. There are going to be unanticipated wrinkles. but he was talking about 20 million vaccinations by the end of December, 100 million by the end of February. It doesn't seem like that's where we're on track for at present. And so how do you respond to how things are going and if those goals are still realistic?
Well, there is 20 million doses sort of being shipped to the states and delivered to them. I think that we have been on track in terms of both the delivery, the production of the vaccine doses by the companies, and the allocation and shipping and delivery. There's always sort of a lag between allocation and the shipping and delivery, then delivery and administration of the vaccine, and then administration and then the report of the vaccine, because there's sort of 4 steps here before we know how many vaccines have actually gotten in people's arms, because there's another person doing the reporting at the end of that chain, telling us, and then we tell everyone. So at the beginning of that step, yes, that's fine. We're shipping the vaccine doses exactly where the states and the other jurisdictions are telling us to ship them. Those are going out the door. And so the work to ship the vaccines to those locations we think is going pretty well, thanks to the work of General Perna's team here, Operation Warp Speed. So I think now we get down to the level of like where are the vaccines being administered, and there's a tremendous variation. The states, we've been sort of put out a template plan in September for the states to adapt to. They gave us all their plans. They looked fine, but of course there's always implementation issues, and we see a real big difference. I mean, you have states like South Dakota, North Dakota, Connecticut, Maine. They all are reporting 60-70% of the doses delivered. And that's obviously rolling distribution. We're putting out doses all the time as the production comes in. You have states that are kind of in the middle, and then states that are reporting, less than 25% of delivered doses. So, we've got a tremendous variation between those hitting, 70% marks, like South Dakota, and those like Virginia that are currently reporting less than 25% of delivered doses. And again, there might be a gap in the reporting, but you got a big swing there.
Well, how can CVS and Walgreens help out?
Yeah, I mean, you look, we put out, some guidance there and some protections for them, pharmacists and their pharmacy techs, to make sure that they wouldn't be subject to liability. That was one of the issues. But I think CVS and Walgreens, or any private partners that are used to administering doses, would be potentially great partners for the states to look to. When they see that sort of doses are being stopped up in a particular area, or there's not, one of the places they had indicated to do the dosing is not efficiently carrying that out for whatever reason. There could be any number of reasons for that. That's really why we look to the states and localities to look at these. They're going to have that more particular information, certainly better. They're better situated than we are here in Washington to know what those kinks are in the distribution system and to say, we need to get those doses back, or sort of fix the area where you're seeing kinks in the system, or get them, sort of change your direction. You've seen that in Florida. You've seen that in Georgia, announced plans for them to kind of shift and get those vaccines out. When events happen and you see the plans, as they say, plan only survives until it meets, reality. When they saw the plans, that's when you adapt on the fly. And you see leaders like Governor DeSantis that are able to adapt on the fly and start changing their plans to make sure you get the most number of the doses of vaccine out the door and in people's arms, which is the goal.
And so for those states that do have kinks in the distribution system, as you're describing, the HHS is in contact with them. There's there's a dialogue, there's a back and forth in terms of trying to remedy whatever the problems are.
Well, they reach out to us, but, in many cases, what they are going to be doing is reaching out to those local distributors and those local institutions that we ship them to do that directly. We're always available and have been talking with them about potential issues, information that we have, advice we can give. But there's a gap between that, what we do in Washington, and really what we look to being done on the ground, at a particular hospital or at a particular clinic. Where state and local authorities are going to have far more information and be more efficient about dealing with those issues when they get the information there. We're always happy to help. We've been helping all along, helping them, through CDC and others, trying to help them get their plans together. But obviously we're seeing a varying, as one would expect on a country as big as ours and as with so many different circumstances, we're seeing a lot of differences among the states in their ability to get those doses out the door efficiently into people's arms.
With respect to the vaccinations, does HHS have any perspective on this argument between those who are promoting a first doses first approach to vaccination, suggesting that basically 2 vaccinated people confers more immunity than 1 double vaccinated person, and that there shouldn't be stockpiles being held back for the second doses for individuals who got a first dose vaccination? You should be vaccinating as many people as you can with that first dose, and then continuing to ramp up production as you need to get the second doses out. Does so there seems to be a disagreement about approach there, and I wonder where HHS is at on it.
Well, I don't think that so for example, the clinical trials that were done for these vaccines did not indicate, they didn't do a kind of a real scrub on the difference between 1 and 2 doses. We do have, there's some provisional thoughts about that, about what kind of what protection people have seen between 1 dose versus 2 doses. We know what the 2-dose numbers are because the clinical trial was done with that in mind, was this first shot plus the booster. So and there have been thoughts about, obviously, put all the doses out there. But if you had a shutdown in production between that first and second dose, and you found that the protection was waning because the first dose wasn't enough for more permanent protection or high enough, then we would be in a worse situation where we hadn't held those doses back and instead had a situation where maybe the production wouldn't keep up, or maybe there would be, anything can happen with production. If you've been around enough, you see any situation where a plant, something goes wrong with the power supply or anything that can go into a plant, and you just don't want to be in that situation. From a prudential point of view, you don't want to be in that situation. So hence the holdback and proceeding as the clinical trials, as the data had said, 2 doses for these first 2. Obviously, we have vaccines coming up. We've got vaccines in the last stage of clinical trials. We may see some upside surprises from some of the vaccines that are in late-stage clinical trials. That could happen soon, honestly, with some of the candidates. But again, that would be an upside surprise. In that case, we're going to have access to more vaccines, hopefully,
and that
more
means
production capacity.
Johnson & Johnson, right? Because their vaccine is only 1 dose instead of 2.
Exactly. And so you got a 1-dose vaccine potentially, which is in the last stage of clinical trials. And so, as we gather information about it, obviously, hopefully that works out, and we can start bringing even more capacity online if that works out. We've got it in AstraZeneca in last stage of clinical trials, and several other vaccines that are also out there, thankfully, waiting in the wings. In the meantime, we have to, use the production capacity from the first 2 companies. It was frankly a miracle that they got those done. I think that's what was predicted by the press. It would take a miracle. So but we have it. But we also want to make sure that we follow where the data was developed in the clinical trials that the companies brought us. And not really kind of go, there could be a promise of 1 dose being good enough.
With the vaccines, still this is going to be a process that's at least a month in terms of the distribution and the vaccinations that would rise to the level combined with infections of herd immunity, it would seem. At least that's what some of the experts suggest. Is HHS...
Yeah, some suggest that. Yep.
Is HHS still tracking the developments with therapeutic treatments? There was a study out, another study actually, about this anti-parasitic drug. Actually, it's a head lice drug called ivermectin. A study out of Liverpool University suggests that, and it builds on an earlier study of the same drug that suggests that it has a real impact in terms of eliminating the viral RNA in the patients who were part of the study.
Yep. I think that there's literally hundreds of potential therapeutics out there. Everything from the monoclonal antibodies that we sponsored out of Warp Speed through any number of other potential things. And I think that's where, a patient talks to their doctor, they look at those, provisional results and decide what's best for them to do. We don't regulate the practice of medicine here at the federal government at HHS. So for people to take a look at that information, talk to their doctors, figure out whether that's something that they want to look at, is something that is completely valid for a patient and their doctor to do. I can't give an opinion about any particular product myself, but that's where the kind of freedom that we have to look at these things and decide what's best. But one of the things that we want to make sure we do is to make sure that people do know that there are lots of therapeutics out there that have been developed that are available to people to get uptake on that. So that's important, especially as you well said. This is going to be a process, even at the quickest pace. This is going to be a process of getting 330 million people, or however many people will choose to be vaccinated, getting them vaccinated. So even on our, the best estimates that we had and have at the time, the 100 million that you mentioned, that the Secretary mentioned, by the end of February. And by the way, we are seeing some signs that the pace of vaccination is picking up. I think people have seen are adapting on the fly as they see who's willing to take the vaccine, where they're willing to take it, who's doing a better job than others at getting it out there, and what modalities are being done. So I'm happy to see that. I think that people are being sort of awake about the issues that have developed. Not everybody. Some people are really stuck in their plans, even when they don't work. Dangerous place to be is to double down on a plan that didn't work and try to just keep jamming at it. But that's the situation that in many cases some jurisdictions are going to be in. Unfortunately.
Yeah.
At least for now.
Yes.
So,
We've seen a lot of politicians. We've seen a lot of politicians doubling down on COVID-related policies that don't work across a range of topic areas. No question about that. Eric Hargan, Deputy Secretary of Health and Human Services. Eric, thanks for joining us. Appreciate it.
Sure, absolutely. Thank you.
Thank you. And he joined us on our turnkey.pro answer line.
Listen to podcasts of Dan and Amy from the AM 560 mobile app. Download it today at 560theanswer.com/mobile.
Steve Cortez here. Small business owners and those of you who make marketing decisions for businesses, listen up. 2021 is here. How's your marketing plan? 2021 will be a comeback year for so many small businesses, but you'll bounce back faster if you're getting your marketing message to the right audience. That's why you need to become a Food for the Poor business benefactor. We run this campaign in November and December, but we always have a few slots that open up in January. So don't wait to take advantage of them. Here's how it works. You make a $2,500 tax-deductible donation to Food for the Poor to help them as they provide food for children in Latin America and the Caribbean. All that money goes to Food for the Poor. Then AM 560 gives you 40 60-second commercials to air right here on this station, Monday through Friday between 5 a.m. and 8 p.m. Absolutely free. That's the best marketing deal in all of Chicago radio. To become a business benefactor, call Anjanette at 847-472-8951. That's 847-472-8951. Or go online, 560theanswer.com/food for the poor.
Hi, I'm Wayne Burdick from Burdick Health Insurance Services. I've been telling you how you can save as much as 50% on health insurance plans. And even though it's January, I can still help you save a lot of money on health insurance. Have you missed the deadline for Obamacare? Priced out of the market? Been laid off? Is your COBRA coverage close to expiring? If you are relatively healthy, I can help you immediately. Save as much as 50%, get covered for 30 days or for a year with an annual renewable policy. Will you be retiring this year and enrolling in Medicare and in need of Medicare supplemental plan? Let me help you get enrolled and save on the best supplemental plan for your budget. If you're a small business owner needing the lower cost of coverage for employees, I can help with non-Obamacare plans with many options. Stop overpaying. Call me, Wayne Burdick, for a free quote at 847-274-5918 or go to lowercosthealthplans.com. That's 847-274-5918 or lowercosthealthplans.com.
AM 560, The Answer.
Coming up on Chicago's Morning Answer.
We'll talk to former Ohio Secretary of State, former mayor of Cincinnati, and member of the Trump-Pence campaign